Thank you, Mr. Chairman. Secretary Becerra, I'm glad you're here for this important hearing, as your agency's budget request is somewhat troubling in what it includes and what's absent from being included. I mean, as several of my colleagues have noted, there's hardly a mention of the greatest health crisis that our country's facing, the fentanyl epidemic that spiraled out of control thanks to the open border policies that President Biden has been promoting. However, my concerns aren't with the budget, but also with the policies HHS is elected to pursue, even over opposition from this committee and community health leaders across the country. Mr. Secretary, I'm immensely concerned about the nursing home staffing mandate that the agency proposed last year. I know several other members have talked about that. I mean, the rule that's currently under final review at OMB suggests that you're pushing ahead to finalize it, despite the fact that thousands of nonprofit nursing homes and organizations, particularly representing rural providers, oppose the mandate as it's written, including nearly 1,000 that signed a letter to this committee in support of the bill to prevent the rule from being finalized. And I know there was comments earlier about the number of people that died during COVID in a nursing home. That's really not apples and oranges in terms of comparing that. I mean, the problem with people dying in a nursing home was because governors in states like New York and New Jersey and Michigan ordered sick individuals to be put into the nursing homes, thereby to infect so many other residents. So I don't know that we want to use that as a standard for moving forward during a non-pandemic time. Mr. Secretary, can you remember the amount of money that your agency estimated compliance would cost nursing homes in Kansas?
Congressman, can you repeat the question?
Do you remember the amount of money that you've assigned or that you'd estimated would be compliance costs for the mandate in Kansas?
I'd have to get back to you for Kansas in particular.
That was a little bit of a understanding. I didn't expect you to really know. I know with all the states you have to deal with. But I'll jog your memory. It was $25 million for the state of Kansas. But along with the mandate for across the country, it also provided $75 million to improvise and support the nursing workforce nationwide. I wanted to point out that $75 million is the same amount that my home state of Kansas will have to expend over 3 years. So it's less than 1 year even of implementation in your home state of California, where the agency estimates that it costs $222 million annually. We've heard nothing from the agency about how you're going to spend that $75 million. Can you talk in details of how you're going to spend that money? What do you expect it to cover? How do you expect it to move the needle to enhance our staffing shortages?
Absolutely, Congressman. And if you recognize that we don't run nursing homes, we don't run most healthcare facilities, we support them. And the way we do that is through the states. And so when the president wanted to put out the $75 million to help boost the workforce, to help make conditions better, it was in partnership with the states. So the states and the local health entities that would apply to get the money are the ones that would determine how it would be spent. What we did was we put guardrails to make sure how it could be spent, but then we leave it to the state and locals to determine who gets it.
Right, but I mean, $75 million won't cover $222 million in your home state of Kansas for 1 year, or your home state of California. I guess I really have concern about the mandate wasn't really thought out, and that the support for nursing home workforce really wasn't necessarily good leadership or good, that there was pre-thought in terms of how to make that happen. I do have a bill, like most of us up here, in terms of talking about how do we move forward. We've got a bipartisan bill called Ensuring Seniors Access to Quality Care Act, which would allow nursing homes that have been forced to suspend their in-house CNA education programs due to restrictions from violations to resume those programs once the quality standards are met. It's a common sense bill that actually accounts for some of the current workforce challenges that nursing homes face, and without compromising the commitment to quality care for residents. And it's not something where we're throwing money at problems. We want HHS to help commit to advancing creative solutions that'll help address some of these problems healthcare providers and patients across the country face. And we know, as mentioned earlier, in rural areas it's harder to staff. These challenges are even more acute and add to the burden and worry of patients in rural areas. A recent survey showed that 58% of rural hospitals are at risk of closing, with 82% losing money on patient care. And currently in Kansas, my home state of Kansas, there's 29 hospitals in Kansas at immediate risk of closure, which accounts for about 28% of the rural hospitals in the state. So obviously there's some healthcare concerns we've got to address. Unfortunately, I'm out of time, and I don't have time to ask you any more questions about these issues. Mr. Chairman, I'll yield back.